Really?
I love this song so much.
Okay, just move you.
Okay.
Okay.
How I wish say yeah. I feel with you anywhere you day. You day. Far away. That's one no say make you the bone. Motherland, yo. You say you gon' call. Everybody went tired when you call. You tell why you go like so. From Germany to carry cocoa and Yankee, but then cocoa goes for your belly. Rest in peace. You fly away. I come wonder if one day you feet come back, yo. Your papa land, yo, I understand. Say you be so far away. Long, long way from home. Long, long way from home. You got a long, long way from home. A long, long way from your papa land. I could have been no matter where you go, make you not forget it.
Okay.
Yeah, perfect song for the discussion that was going on.
Oh, you were listening?
Yeah, I was listening.
All right. Yeah, right. Because I'm like, everybody,
Yeah.
the most annoying was the one saying Nigeria is a lawless country, only the
Yeah, the
rich.
last guy that called in.
Are you for real?
Huh? I don't. I make it a point of it not to convince people not to go. I want to go.
Do you know the number of people that have left that I know? All right, we're coming in.
Okay.
Sound Sultan, God rest his soul, with that very good one with a lot of good words. And of course, the message is very clear, especially considering our question of the morning on breakfast. Well, yeah, we're still on breakfast in bed. Do not now, let's not go there. Maybe we will actually have a part two of that conversation next week. Cisco Delgado did suggest that there are a lot of issues we need to thrash out and, many suggestions, solutions. I do not like the fact that people say Nigeria is a lawless country and only the rich can enjoy it. So people should go out there and make money and come back to enjoy it. No, that doesn't sound right. But you know what? Away from that conversation, because now it's all about bad breath. Halitosis, how can you deal with it? How can you even know that you actually have bad breath? I did say that 1 in 4 persons are estimated to have bad breath. And so if you are gathered you have 4 people around you or 3 people around you and nobody seems to have bad breath, maybe you're the one. I'll confirm that data with my guest. Now, if you're a part of our YouTube family, you will definitely see what's going on in the studio already. And the channel you're looking for is Smooth 92 FM Lagos. So go right to YouTube and search for Smooth 92 FM Lagos. Come to WhatsApp and be a part of our WhatsApp family, 0809 444 0981. That accommodates your questions, your comments, feedback, anything whatsoever that allows you to be a part of the show. But then if you want to get your voice heard, well, literally, you can call on 01448 9981. Ladies and gentlemen, please welcome the lead concierge or rather the lead dentist at Concierge Dentist, and his name is Dr. Deji Kowobari. Good morning.
Yeah, good morning, show.
I feel like I just mixed up it's Concierge Dentist, right?
Concierge Dentist NG.
Great, thank you so much.
Yeah.
How are you? It's been a bit.
Yeah, I'm good. I'm very fine.
Okay. Hope that you're not thinking of leaving Nigeria too, because we need all the medical hands that we can get.
Oh God, I'm not thinking of leaving Nigeria actually.
Thank you.
I jokingly tell people that they don't need me there.
Oh, yeah. We need you here. We do need you here, because if we didn't have you here, I don't know who I will be talking to about bad breath right now.
Yeah, but a lot of my colleagues are leaving a lot in their drones. Can't blame anybody. I've made it a point of duty not to convince anybody not to leave. It's a lot.
Yeah, I mean, according to one publication, I think from Premium Types in the course of the week, it was said that about 100 consultants from MDCN, that's the Medical Dental Council of Nigeria, have left in the past 2 years. 100 consultants.
Yeah,
And
yeah.
considering what it takes to be a consultant, you just go with all of that experience. Ah, no, I don't want to do this. All right, let's go back to bad breath halitosis. We do know literally that bad breath is bad breath, but what we do not know are the causes. So let's dive right into the causes of halitosis.
Okay. Before we talk about the causes, I think it's good for us to still lay a good background for what bad breath is.
Okay.
Yeah, medically called halitosis, also known as bad breath, and then commonly known as mouth odor. It's a persistent, unpleasant, foul smell that comes out of the mouth when one is talking. And the reason is because when we want to talk, we breathe out. So you can't talk while breathing in at the same time. So you breathe in air, and then when you want to breathe the air out of your lungs, the air come out of your lungs, and depending on how you manipulate your vocal cords and the structures within your mouth, that was what will determine the kind of sound that will come out. So when people are releasing air from the mouth while speaking, if the air is bad, if the air is not good, that's what we call bad breath.
Mm,
Yep.
okay. Thank you for helping to get that out and laying the basics. Now, since you cannot hold in your breath while you're talking, you need to breathe out, you need
Yeah.
to talk to people. What are the possible reasons why your breath will stink when you are talking to people?
Okay, so there are two major categories of causes of bad breath. There are what we call the oral causes and the systemic causes. The oral causes because the mouth is one of the major passageway through which the air that we are breathing out passes before it comes out, and that's one other reason why we also call it mouth odor. So there are local causes, which is the oral causes. The major and most common cause of bad breath within the mouth is accumulation of plaque and calculus.
Oh.
Yes. So when we have debris, those yellowish or greenish deposits that are attached to the gums and the teeth, stay there for a long time. When air is passing through the mouth, it gets to be bad, and then it comes out badly like that. So poor oral hygiene, basically, it's the one of the major or most common causes of bad breath. Poor oral hygiene. Another major cause of bad breath is diet, the kind of food we eat. So there are some food substances that have some other substances within them that when metabolized by the bacteria that are naturally occurring in the mouth, they produce some substances that have bad breath. So things like onions, garlic, ginger, yeah, and quite a number of other stuffs also. Oily stuffs could make the mouth to smell. Yeah, another thing within the mouth that can cause bad breath is cavities, decayed teeth. So when we have a tooth that gradually over months or years have started decaying for a long time, the space, the cavity caused by that tooth will create a space for remnants of food to lodge into. As the remnants of food are lodging there, the naturally occurring bacteria in the mouth keep acting on those food to produce those gases that are odoriferous. And then by the time the air passes through the mouth, it spoils the air and then it's released into the atmosphere as bad breath. So those are some causes of bad breath within the mouth. Outside the mouth, which is the systemic, which is the rest of the body, which is a system. Some causes of bad breath could include, so like I said, as the breath is coming out from the lungs, it's passing through the throat, the nostril area, the pharynx, and then into the mouth. So some respiratory diseases could be causes of bad breath also. Yeah, because the lungs is a part of the respiratory system. So if the lungs are not okay, some respiratory diseases could be causes of bad breath. Vomiting, any disease condition that could cause one to vomit continuously could cause bad breath, because when you vomit, most of the time the substances within the stomach comes back into the mouth, and because they've gone in, by the time they're coming out, the smell is totally different. So There's a disease condition called gastroesophageal reflux disease, GERD. It's a condition that makes people vomit a lot of times. So when that is happening consistently, it can make the mouth to smell badly. Yeah.
Okay, so for the sake of the layperson who has no, uh, okay, you know what? Actually, we need to take a break, and when we come back, we will continue this conversation. This is Smooth 98.1.
Wellness
I
is an
missed the time.
important part of your general well-being. Don't take
I
it for
missed the time. We
granted.
will come back
This simply
just in
means
less than a
that there
minute.
is no better time to take care of your health other than now.
And removing the barriers to the healthy lifestyle choices that we make every day.
Evercare Hospital Lekki presents Smooth Health, a program dedicated to share insightful tips and information to live in a healthier and happier life, featuring qualified and professionally trained medical personnel.
Whose mission is to make the healthy choice the easy choice.
Tune in to Smooth 98.1 every Thursday at 5:15 p.m.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria. Stay tuned, everyone.
That's the golden command. Don't even think of touching the dial because we are talking about your health and you should be a part of this conversation. You should listen and, of course, contribute if you have anything to say. And if you have a question, you can do that. Come through on WhatsApp by sending your message to 0809 444 0981, or you can drop it also in the chat box on YouTube. That is at Smooth 981 FM Lagos. Or you can decide to call in on 01448 So before quickly taking that break, I was going to ask you, from what you have analyzed, so bad breath can be temporary, in quotes,
Yes.
or it could be chronic.
Exactly.
Great. So I decided to just break that down so that somebody eats garlic, in that moment you're definitely going to have bad breath.
Yes.
But then consistently eating it will now stretch it to the maybe chronic. No, I wouldn't want to use chronic, but at least
Make it more persistent.
persistent.
Yes, exactly.
All right. So according to data, it is said that bad breath is one of the reasons, the third reason, people seek dental care after tooth decay and gum disease.
Yes.
And while you were talking, you mentioned how there could be bad breath as a result of a tooth decaying. Now the question is, what causes tooth decay?
Oh, interesting. That's a different topic entirely.
Yeah, I
I'm
know,
going to summarize
because
briefly. Yeah. So, what causes the tooth decay is as a result of the action of naturally occurring bacteria in the mouth on the remnants of food that we eat. So, in the mouth, there are naturally occurring bacteria that are not harmful. They are needed to be there so as for the mouth to have the normal biofilm environment, for everything to be okay. But when we eat, not all of our food goes through the esophagus into the rest of the body. Some remnants are on the surfaces of the teeth, the gums, the tongue, because those are the things within the mouth that we use to chew and break the food down. So the naturally occurring bacteria in the mouth, they act on the remnants of this food, and then they release some acids. So it's more like they too are eating and they are pooing. So their poo is like the acid. Now, as hard as the enamel is the hardest substance in the body, other than bone, the second hardest substance in the world, second only to diamond. As hard as the enamel is, consistent and continuous deposit of acids on the enamel will break the enamel down. So it breaks it down, we call it cavity, in a process called demineralization. So the D there, DE, is removing the minerals from the enamel. As it's removing it, cavity is being formed. And then if this is continuous for a long time, it keeps going deeper, wider, depending on the pattern, depending on how the person eats, and a lot of other things like that, till it gets down to what we call the pulp. When the cavity is still within the enamel, you won't feel any pain because there are no nerves within the enamel. But when it gets down to the dentine, there are stumps we call dentinal tubules that can make you feel sensitive to either cold or heat. But if you don't do anything at that point, it gets deep down to the pulp, and that's where we have the life of the tooth, the nerves and the blood vessels are connected to the brain. And that's where, whether you are eating or not, you are sleeping or awake, pain can start at any time.
Interesting.
Yeah.
Now let's talk about the fact that some people do have bad breath and they do not know.
Yes.
How does that happen? Your breath is in your face. How does that happen?
Well, it happens because it's for some people. So it depends on the cause also. For some people, it's something that's been with them for a very long time, and they are so used to it. So at times it's just like someone who is staying close to a dunghill. For someone like
What a
that, at
description.
times, yeah, sorry about that. At times it could, you could take someone from outside to come and say hello, or just like imagine some people who stay very close to the airport,
Mm.
and you're in their house for the first time, and you're like, planes are flying, arrivals and departures, are you guys not listening to the sound and all of those things? So yeah, so there are really no particular reasons why people don't know that they have bad breath, but it happens a lot of times, because they are just used to it. So for some of them, so a lot of dental stuffs are highly psychological.
Oh, wow.
Yeah, no, not really psychological in that sense of mental health, but in terms of personal preference. So for some people, a kind of smell is normal to them,
Mm.
while for others it's so abnormal. So the same way two people can enter a room, one is thinking this room is stinking, and the other is like, there's nothing wrong with this room. So someone could have bad breath and don't know.
So even if I give the person a mask and you wear a mask and your breath is literally going back to your face, you still think it's normal.
Yeah, yeah.
That is something. All right, we have another class of people who are actually constantly worried about bad breath. I think the condition is called halitophobia.
Yeah, alitophobia. Yeah, a situation where there's really no bad breath, but they think they have bad breath. We have such situations. People come to the clinic and they say I have bad breath and all. So when a patient comes to the clinic and you as a dentist, maybe the patient had told you before I have bad breath. Most of the time, you as a dentist want to wear your face mask before you examine. But in such situations, at times you'd have to lower your face mask to perceive yourself to confirm the patient as bad breath. So at times when someone comes to the clinic and we're talking about bad breath, we ask questions like, how did you know you have bad breath? Did you discover it yourself or someone told you? If the person was married, we ask things like, did your spouse tell you? Did your children tell you? So I had a patient at some point who is a very public person, one of the best public speakers in Nigeria. And he told me, he said, I observe that anywhere I go, people keep covering their noses. People keep moving back away from me. So that was like 4 years ago, and did some examination, checked his mouth, realized that it was simply because of accumulation of plaque and calculus over the years. And between then and up until like sometime this month, we do regular scaling and polishing for him, and he was still telling me the last time that thank God that he's far better now. That at some point where he goes to speak, even guest speakers don't sit beside him, so it could be that terrible, so it could be that terrible at times.
If I hear you correctly, addressing first, when you want to diagnose bad breath, you have to smell it, right? You have to smell the person's mouth.
Yeah, in some sense, but we have other diagnostic tools that we use
Like,
within the dental clinic. There are some tests you could be asked to carry out that could also prove that one has bad breath. So the thing is that in the medical world, in dental field, when you want to diagnose something, there are different steps of diagnosis. There could be history taking, when you are even discussing with the person. For example, now one other major cause of bad breath that a lot of people don't know, habits, smoking and tobacco consumption. Yeah, because tobacco consumption can lead to dry mouth. Dry mouth is also another major cause of bad breath because when the mouth is dry, so the saliva production into the mouth, there's an amount of saliva that is produced per day from the salivary glands that are around the mouth. These salivary glands, they open up into the mouth through different salivary duct openings. So it's more like we have a swimming pool, there's a source of water, and there's a place all of this water enter into the pool. Now, if there is no water, or in a car wash, if there's no supply of water to the car wash, every car that is there is going to be dirty. So there are some conditions at times that can lead to dry mouth. So if there's not enough water from the saliva bathing the surfaces of the teeth and the gums and other structures in the mouth will tend to be dry, and there's a high possibility of bad breath. And that's why at times if you're fasting,
I was just going to say
if
that.
you have not spoken for a long time, if you are working in a place where you don't talk to anybody, you're just there for like 8 hours, you're just working, you've not said anything, your mouth has been shut. Because speaking also and moving the structures within the mouth encourage saliva production.
Mm.
Because you can't even speak well if there's not enough saliva within your mouth.
Wow.
Yeah, because the saliva make the tongue glide.
Lubricates it.
Exactly. So the lubricating function of the saliva also helps. So so that's why at times when fasting, and that's why at times even when someone says they have bad breath, one of the simplest things you can do is to take enough water, rinse your mouth regularly, and a lot of other things like that.
Wow. I am sorry, dear saliva, for taking you for granted. I appreciate you more now.
Very, very important actually.
Wow.
Yeah.
Okay, now let's go back to how you can get rid of bad breath. Now, from what you have inferred, or at least from what I can infer from what you have said, it means that dealing with bad breath will require you getting to the root cause of it.
Yes.
In that case, those who market breath fresheners, how much effectiveness do we get from breath fresheners?
Okay, so when you want to solve a problem, the first thing to do is to discover the cause of the problem. So going to a breath freshener or getting a breath freshening product isn't the right way to try to deal with bad breath, because that product could be one of the solutions to bad breath. But you need a professional to help you detect the cause, to now say this bad breath freshener or something all of those things is a solution. So the ideal solution to treating or curing bad breath is to see a professional. The professional is a dentist. So when you go to see a dentist, the dentist, like I said initially, takes a history, we call it history, and then after then does an examination, goes into the mouth. And that's where I talked about the dentist himself stylishly trying to perceive himself. So the dentist checks the structures within the mouth. So like I said, about 70 to 80% of the cases of bad breath is due to poor oral hygiene. And poor oral hygiene is majorly due to plaque and calculus accumulation. So when the dentist checks the mouth and he sees that there's a lot of deposits on the teeth, most especially the back teeth, it's just like a give or take. By the time what we call scaling and polishing is done, it's in almost all the cases going to eradicate bad breath. So there's an interesting case at times when because there's pain on one side of the mouth, people abandon that side of the mouth and they don't chew with that side of the mouth, thinking that at least if I don't disturb you, you won't disturb me. But it's kind of unfortunate that once you abandon a part of the mouth, that part gets dirtier.
What?
So when I look into a patient's mouth, depending on the part that is dirtier, 100% of the time, I tell you, you're not chewing with the side of the mouth. They're like, yes, it's true. And most of the time, you see a hole on one of the teeth on that side of the mouth. So the reason why it's like that is because by the time you don't chew, for example, with the left part of your mouth, the chewing action, so when you put food into your mouth, the food is on your tongue. The food goes everywhere in your mouth. If you are chewing with the right side, the cheek from the inside and the teeth are working. So food don't stay there. But if you abandon the left side, the food that went there, nothing is bringing it out. So that's what make a lot of debris accumulate there. Bacteria in the mouth act on those debris, they make them solid. It causes plaque and calculus. So most of the time, so poor oral hygiene, and then the dentist checks also for decayed teeth.
Yeah, back to that tooth decay.
Yes.
You know what? We will definitely quickly get to the reason why the tooth. Okay, we've gotten to the reason why your tooth is decaying. Well, let's talk about how you are supposed to brush your teeth and what you're supposed to do after, because I have realized a good number of Nigerians do not floss. In fact, they do not understand what you should do with the dental floss, except when you eat meat and they just want to get it out. For those who are not using toothpick, that is. So quickly, we will get to that. This is Smooth 98.1. Just a quick ad break.
98.4. Smooth. 98.1.
We actually just have 5 minutes more.
Yeah.
Time flies really fast.
Now the total energies AFCON bonanza. Yeah, so sharp sharp, go place bets for your favorite team for 1xbet and get that whopping win. Go place your bets for 1xbet.ng. Use promo code CAN Nigeria and win with 1xbet. 1xbet, anybody fit dey lucky.
Love music.
It's a new
Yeah.
day, and I'm feeling good.
I have a few times said that if you have experienced a heartbreak, it is painful. But have you experienced a tooth pain? That thing is extra painful. So we will quickly talk about how you can prevent tooth decay and, of course, how you can take care of your oral health or your dental health better. Oh, by the way, what's the difference between oral and dental health?
Same thing.
Ah,
Dental, same thing.
okay, great. So let's talk about how you can properly take care of your teeth and your tongue and your saliva and everything.
Yeah, because everything within the mouth needs to be taken care of.
Mhm.
Yeah, so basically oral hygiene practices, good oral hygiene practices. The commonest of them is brushing. Brushing twice daily. In the morning and last thing before you sleep at night. So brushing basically is the mechanical way by which we try to remove the remnants of food that are on our teeth. Because if those remnants remain there, they can cause bad breath, poor oral hygiene, they can cause holes to form on the teeth. So you brush using a toothbrush and a toothpaste. So the toothbrush we usually recommend.
Thank you, because
Yeah.
I was going to ask that. Nigerians do have that habit of using smokers' toothbrush. They believe the harder the bristles, the better it cleans, and in the course of that, damaging the gum.
Yeah, exactly. So the toothbrush we usually recommend a medium textured toothbrush. Medium textured, I mean when you touch the bristles, it's not hard and it's not soft. There are situations where we recommend soft brushes, for example, for children or for adults, elderly people, old age that have some conditions. So not necessarily the hardness of the brush that determines whether you're brushing well, it's the technique you use to brush. The reason why it's not good to brush with a hard brush is because it can damage the gums. Yeah, and it could be even too hard on the surface of the teeth, causing some form of abrasion. So then the toothpaste we usually recommend. I know there are a lot of toothpaste flying all around and everything like that, but the gold standard
No brand
is,
name.
yeah, no, definitely not. The gold standard is any toothpaste that contains fluoride.
Ah, yeah.
Yeah, so just I was still analyzing with a client of mine 2 days ago. He brought out his toothpaste and all, and I had to show him, there's fluoride on this sodium fluoride, 1,450 parts per million, because the major thing we are looking for in the toothpaste scientifically that can help prevent caries is the fluoride content. Yeah. So so brushing. Another thing is flossing. Now, this is also an interesting one. It's good. More Nigerians are beginning to floss. So the reason why we have flosses is because the toothbrushes can't get to the tight junction in between the teeth because they are supposed to be opposed. So the floss is a thin thread that goes in between to remove the remnants of food in between, because if we don't remove them, holes can start in between those tight junctions. So but the thing is that I know there are two types of flosses commonly in the market. There's the one that's
Yeah.
just a thread that
Yeah.
you just spin around your two index fingers and then you put it in between. But I think many people don't really like that because of the stress.
Yeah.
Then people now use the one that's like plastic and has
Yeah.
a small thread. Now the issue with that style is that people wrongly use it.
Ah,
You should use the thread, not the sharp end.
yes.
So when people say I'm not using toothpick, I'm using a floss, but they are using the sharp end that looks like a toothpick to poke their gums and
That thing
create
looks like a
pockets.
sequel.
Yeah. So we possibly need to get to a point where the end has to be bulbous, so it doesn't look like a toothpick. One other very important and one of the most important things you need to do to have a good oral health is to visit the dentist consistently.
Like consistent, how many months or years?
Twice in a recommended twice in a year, at worst at least once a year. It's so sweet now that you can either visit or even schedule a visit for a dentist to check you up, in your place, your house, or your office. So because as good as it is to brush regularly and floss regularly, reduce sugary stuff, steak and all of those things like that, dental conditions are very, very funny. They start very gradually, and when they start, most of the time you yourself don't know, because of the roughness of the surfaces of the back teeth, which is very important for friction and for chewing. all start in the grooves and fissures, the rough surfaces, and most of the time we don't know. Like I said earlier, when the hole is within the enamel, you can't even know yourself most of the time because there's no pain. But the dentist can help you detect it and then help prevent dental emergencies. So we as dentists always say that we should make it a point of duty to visit the dentist twice in a year, at worst at least once in a year.
All right. Auntie Talks on WhatsApp says, please tell the listeners we should brush the teeth after breakfast and after dinner. Flossing very important at night too. Rinse the mouth with water after every meal.
Perfect. Yeah, she's correct. Everything there is correct.
Thank you, Auntie Talks. Oh, the last one. Now, a good number of people are beginning to adopt this method where after brushing, they do not rinse off their mouth. What do you say to that? Quickly.
Yeah, so everywhere I go, this is the last thing we usually talk about because it seems to be like a new thing. You know, this generation we like new stuff and all of those things like that. But I'm going to within like a minute quickly clarify this. Scientifically, it's not proven whether if you rinse after brushing or you don't rinse, you have a better chances at a good oral health. In fact, a study was carried out where a group of people for a period of time were asked not to rinse, while a second set of people were asked to rinse. There was no significant difference. You know, I said something earlier on that there's a lot of habit and choices and psychological stuff that has to do with oral health. You know, so the reason why I do not most of the time say don't rinse, your oral health will be good, blah blah blah, is because generally people always look for that one singular act or one singular product that will guarantee a perfect oral health. So by the time you start propagating if I can use the word gospel of, once you don't rinse after you brush, the fluoride remains on the surfaces of your teeth and your teeth get stronger. In fact, I saw something where someone said it makes your teeth whiter. It doesn't make your teeth whiter. Fluoride don't make the teeth whiter. And your toothpaste is not even the only source of fluoride. You can get fluoride from your salt, from water. You know, so whether you rinse or not, it can be cool.
Thank you very much for putting that to rest. Although I know some people will still fight this in their minds, but it's okay. We
Personal
have
preference.
Exactly.
Yeah, some people are not cool with toothpaste remaining on their mouth. Don't feel bad.
Yeah.
Some people are cool with it.
Wilson thanks you and says he's enjoying the conversation and learning a lot, and you are helping him a lot. You're very welcome, Wilson. Thank you to everybody who's been a part of the okay. He says, I have a question. Must you always floss? Brushing twice daily, is it enough? Okay, you know what? We will answer that question up on YouTube for you, so you can definitely go back to the stream and we'll answer one or two things up there, and then you can go back. This channel you're searching for is Smooth 92 FM Lagos. We have to quickly run because we're out of time, but you can catch up Dr. Deji Kowobari across all social media platforms at Deji Kowobari on Twitter and on Instagram. That's Deji Kowobari. He's the lead dentist at Concierge Dentist, so that you can go check them out and of course check out the health information they are putting out there, so that all those school of thoughts that are not so balanced or are not standing on proper scientific evidence can be shifted for you. Thank you again. I'll put this link up on WhatsApp for you if you have missed out the conversation, or there is somebody who you think has a funny breath who needs to hear this or see this. You're very welcome. 8:40 is the time for the kids to come around, and trust me, it will be a very, very great time. Thank you, Dr. Deji, for being here this morning.
Yeah, you're welcome. Thanks so much for having me.
It's a pleasure. All right, stay with us. This is Smooth 98.1.
How is it?
It was great. So let me answer the question for Wilson. Must you always floss? Brushing twice daily, is it not enough? So
You must always floss.
always floss.
Yes, always floss.
All right, Wilson, you heard that? You must always floss. Brushing twice a day is... More people brush their teeth before breakfast. Please tell them it's after breakfast.
Well, if you brush your teeth last thing at night before sleeping, yeah, so you should brush after breakfast. The reason why a lot of people brush before breakfast because they don't brush before they sleep. So when you wake up in the morning, the breath is bad. If you brush at night before you sleep, last thing before you sleep at night, by the time you wake up in the morning, your breath is still cold.
Oh, so when I brush after sleeping, or rather before sleeping, I can easily eat and then brush after eating.
Yeah.
Oh, nice. I like that. Thank you.
You're welcome.
Thank you to joining, or those joining on YouTube.